Hi guys, I'm today going to talk about beard growth, a very common problem for a lot of youngsters and adults too. So there's a lot of topics I'm going to cover, but first you need to know. So the beard growth, a facial growth for youngsters, it starts around 13 years of age and up to around 17 years of age. 13 to 17 is the age where it starts. The beard growth, facial growth, hair, the moustache, the beard starts, and it takes approximately 3 years to achieve a full good growth. But what causes this facial growth? Testosterone. Okay, testosterone is the major hormone which causes the facial hair to grow. There are two other hormones, one is FSH and second is LH. Indirectly, these hormones also play a role in production of this testosterone in our body. So what happens when you attain puberty, okay, and somewhere at the age of 13 and to 16, a lot of hair growth happens on your face and then on your body too. Mainly you need to check for the underarm hair growth, on your chest, your pubic hair, and then on your thighs, how's the growth. So these are all the secondary sexual characters. Secondary sexual characters caused by the testosterone production, and that causes these things. What happens? You also have a manly voice, and then one more thing is your penis also increases in size and your testicles become bigger. These are all the causes, these are all the secondary sexual characters which happen during the puberty age. So if someone complains that their beard growth is very less, okay, or the mustache is not growing, patchy growth, or especially in youngsters, then couple of things you need to check. The first, you need to check whether your hair growth is well developed in your underarms, and then on your chest, maybe around the nipple areas, and in the pubic areas where the hair growth is normal. You need to check first. Second, are you a fat? Generally obesity. If you're fat and having a flabby abdomen, then your testosterone might be low too. And third, sometimes the manly voice would not be developed, and so it still have a feminine voice, so that also is an indication your testosterone is low. And then your penis will be smaller too, and your erection might be less. You might have a normal penis, but then you might still have a erection less. There will be reduced sexual desire sometimes. And then your testes, feel for your testes. If you feel the testes is supposed to be a normal adult, supposed to be around 2.5 centimeters into 3 centimeters approximately. If it is smaller size, feel it, and if you feel it is smaller size, then if you're having a less beard growth, you can correlate thinking that it is hypogonadism, which is causing reduced testosterone. Because of reduced testosterone, and that is in turn resulting in low beard growth. And then also check your chest, whether you have a little bit breast kind of a thing, how women have it. Check it, that you might have a gynecomastia too. These are all, whatever I'm telling now, are the indications of a low testosterone. There are other conditions. There are congenital conditions where people would have got the children. When you were a childhood, when you are when you're young, you would have got mumps. Okay, so mumps is like swellings here. If you had got that, your testosterone might be low too. In case any hormonal, you have to find out from your parents whether you had any endocrinological problems or hormonal disturbances, when you were a child. And then smoking and drinking also causes reduce in reduction in the testosterone levels, which in turn cause your facial growth to reduce, especially in adults. When they smoke a lot or drink a lot, suddenly they might notice there's a reduction in the growth of the beard and the moustache. And then check for penile erections. Your drive will be normal. Sometimes you might have erectile dysfunction. If you have a morning erection, okay, early morning erection, you might have erectile dysfunction too. So check that too. And then sleep is very important. 6 to 8 hours of sleep is very important. If you don't sleep well, that can disturb your facial hair growth. And then also check whether your concentration is good. Are you irritable sometimes? whether you're having depression. Emotional changes also results in reduced facial hair growth, which also reduces the testosterone levels. Check whether you have thinning of hair, and sometimes the thing is, when you have low testosterone, you still have thinning of hair. DHT might be high too. Any sudden change of diet can cause reduction in testosterone, in turn cause reduced facial hair growth. Drink a lots of water. And then protein intake is also matter. Let's come to the diet factor. So before coming to diet factor, you need to know that if you have any of these problems, you might have low testosterone. So what you got to do is, you have to go meet an endocrinologist, where you need to evaluate your blood serum testosterone and your FSH and the LH. Okay, these three hormones you need to get yourself checked. This is the primary. Okay, once you check it, if it is low, then you need to meet an endocrinologist and get your medications to correct those. Many a times when your testosterone levels are corrected, obviously it improves your facial hair growth. When it to get done. Most importantly, you have to go in the early mornings in empty stomach and get your testosterone test, preferably before 7:30 a.m. So which gives the appropriate or the right results in your blood. Now these are the tests. Once you know the test, and then your endocrinologist will help you to correct the testosterone to improve your facial growth. So in terms of diet, will diet cause any change of your facial thing? Yes. Okay. Say there are a lot of vitamins which help in facial growth. Vitamin A, vitamin B, vitamin C, especially in vitamin B, your biotin, and B9, which is folic acid, then your vitamin C, vitamin D, vitamin E, and then your potassium, calcium, magnesium, zinc, selenium. There are a lot of minerals also. So the whole point is, if you are having a balanced diet of a lot of leafy vegetables and a lot of protein intake, especially vegetarians, they should take a lot of protein diet, especially nuts, beans. If they take consumed, it improves the protein diet, and that also indirectly improves your testosterone. So leafy vegetables, and Google and check what vegetables or what foods can improve your testosterone levels. And a lot of nuts can improve too. Walnuts, peanuts, almonds can also improve, and a lot of water also helps. And then caffeine intake needs to be reduced. A lot of coffee or tea intake or caffeine intake in terms of Coke, Pepsi, they can also cause reduced facial hair growth. So there are a lot of things I've told you. First, if you're a person who is less than your 18 years of age, wait. But when you cross your 18 and you're 19 but still your facial hair growth is not there, check for secondary sexual characters, whether you have those. If any of them are reduced, or if you don't have one, go meet an endocrinologist and get yourself evaluated for testosterone and other manly hormones. Then post of which your endocrinologist will help you. And in terms of your diet, take all those vitamins which I had told you. A lot of multivitamin tablets. Don't ask me what tablets to take. A lot of multivitamins are there. Instead of your tablet forms, you can change your diet. Okay, read about it. Whatever the vitamins, whichever diet is good in it, please take those. Okay, improve your testosterone level. That will in turn improve your facial hair growth. Okay, if you're depressed, try to meet a psychotherapist or a psychologist where you can talk about it and get over your depression. Smoking and alcohol will cause reduce facial hair growth. So reduce your smoking and alcohol. So any more doubts, do comment and ask me. I will let you know. Thanks for watching. Bye.